Hello, welcome to Maternity Nursing 1 with me, Miss Kenan, and I'm presenting the topic Intranatal Care from Ibu F. Alberta Latondo, PhD. Today's material we'll learn about the understanding of concept of stages of labor, and then we'll learn about the physiological adaptations response of the fetus and the mother during childbirth, and then we'll learn how to formulate nursing diagnosis for mothers during the intranatal period, as well as develop a nursing intervention plan for the mother during the internatal period. So we're going to have a review on definition of normal delivery. So we understand that normal delivery is the process of the cervical dilatation, the birth of the baby, and the placenta expulsion from the uterus through vagina. And this is according to WHO in 2018, and we already reviewed the document of a positive childbirth experience given by WHO. So, as we talk about labor, we have to remember that there are four components in labor. The first one is passage or the birth canal. So, we're talking about the pelvic bone, how it will then expand it and to accommodate the baby to come through it. And then we learned that there is also a passenger or the baby itself, where we learned that the head will be passing through the birth canal. And the next is the power or how's the contractions of the mother during the labor and delivery, and how she can then do it at her best to accommodate the labor itself to deliver the baby. Then we learn about the psyche or how the mother is tolerating the process of labor, how she then psychologically be prepared to be able to deliver the baby healthily, and also that she maintain her health at the same time. Now we talk about the stages of labor. So we understand that there are four stages of labor, or in Bahasa we know it as kala satu to kala empat. And then the first stage of labor consists of dilatations of the cervix from the latent phase, active phase, and then also transition. So in the latent phase, we know that it's the opening of the cervix from 1 to 4 centimeters, and this happen every 2 hours. And then also in the active phase, we learn about the opening of the cervix from the 5th to 8 centimeters that happen every hour. And then on the last part, we learned that this is the transition where the cervix then be fully dilated 9 to 10 centimeters, and this will happen approximately every 30 minutes. After finish the first stage of labor, we move then to the second stage of labor where the baby will be born, and the baby will go through the crowning process, then the cardinal mechanism where the baby needs to rotate and then to go through descend through the birth canal until the baby will be delivered vaginally. After the baby is being delivered, then we move to the third stage of labor where we then deliver the placenta. Then we'll be able to observe the part of the shiny membrane, what we call the schulze, and then the dirty maternal surface, the one that attached to the uterus of the woman, what we call the Duncan. After delivering the baby, then after delivering the placenta, then we move to the fourth stage of labor, where we then observe the mother 1 to 2 hours after birth, where we expect that the normal blood loss will be around 300 to 500 milliliters. Then at this time, we also see the bonding between the mother and the baby through the early breastfeeding initiation. Next, we learn about the power of contraction in the uterus. So, as we understand, during the labor, the contraction will happen around 2 times in 10 minutes. So, the frequency is the length of one contraction and one relaxation. So then we will learn that there will be the increment of the contraction and then also the decrement of the contraction. There will be the acme or the highest peak of the contraction, and this will be the intensity of the contraction. This period of time will be the duration of the contractions. It would start then with the increasing or increment of the contraction, and then the decrement or decreasing of the contraction, followed by the period of relaxation, and this then will continue again with another contractions and the same period of relaxation. So we are expecting that in 10 minutes when the labor is active, the mother will experience at least 2 times of contractions of the uterus. Now, we learned that there are 2 types of dilatation. So we have the discomfort dilatations. It's begin in the first to the fourth centimeter dilation. This called as latent phase. And we have irregular contraction. The contractions disappear with ambulations, movement, and sleep. And there is no increase in duration, frequency, or intensity of the contraction. And at this time, the cervical dilatations happen very slowly. And we move on after 4 centimeter to what we call pain dilatation. So here the cervix will then open up from 5 centimeters to 10 centimeters, or we can call it also as active acceleration phase. Here the contractions feels by the mother are regular, and it's increasingly strong in their intensity, their frequency, intensity, and then duration also will increases. And here the contraction will also move together with the cervical dilatation. So as the contractions become stronger, the dilation become like bigger, or yeah, it's be like a fully dilation during the contraction. Next one is we are going to learn about the intranatal nursing care. So here we have Mrs. A. She is 25 years old. It's a G1POAO, and she is in the delivery room. Her cervix is completely dilated, thin, and the fetal head is already in the pelvic floor, and Miss A lies in a semi-folders position. She holds her breath and breathes when the contractions occurs. Miss A complained of severe low back pain and did not receive epidural analgesic but received Stadol 1 milligram intravenously 1 hour ago. So the nursing diagnosis for this one will be labor pain. So we can then relate the labor pain through the process of delivering of the baby. Then we can also plan the intervention of providing comfort measures to then eliminate the pain that is happening in the process of delivery at Mrs. A. At the same time, we also encourage the partner to be with Mrs. A and help in delivering the comfort measures such as a Florage massage, and then also movement, and then also using aromatherapy or using um, music therapy so that it will then decrease the pain level that is experienced by Mrs. A. Now we move on to the physiological adaptations of the fetus and the mother during labor. So with the fetus, we are going to see how's the heart rate, the circulation, and the breathing. To the mother, we are going to observe the changes that will happen in cardiovascular, respiration, kidney, or eliminations, and the integument, the musculoskeletal, neurological, gastrointestinal, and even the endocrine system. Let's see about the fetal adaptation. So during the labor, the fetal heart rate that is normally 110 to 160 beats per minute will then be generally around 140 beats per minute. And during the contraction, the fetal heart rate will then accelerate because of the compensations of the compression inside the pelvic floor. And then talking about the circulations of the baby, there are a few factors that may influence the fetal circulation, such as the maternal position, uterine contractions, blood pressure, and even umbilical cord blood flow. And fetus can compensate the pressure from the birth canal. The uterine contraction also can inhibit the fetal circulation through the spinal arterioles and then perfusions of the intervillous space. So with the breathing of the baby, the chemoreceptor in the aorta and the carotid body will prepare the fetus to breathe immediately after birth. Now we are coming to the cardiovascular adaptations of the mother. So in the cardiovascular, we will see that the pressure will increases by 25 mmHg, and it tends to be hypertensive. But then when mother is lying in the supine position, we will see that the systolic pressure will decrease, and also the blood pressure will then tending to be hypertension. And in respiratory, we can see that the uterine contractions can be accompanied by the restlessness or in sometimes anxiety as well. And this will result in the more oxygen consumption so that the breathing frequency of the mother will increases. In the kidneys or in the elimination process, there will be a proteinuria up to +1, and this is a normal findings because then this is the response of the damage to the muscles tissue during childbirth. In hemopoietic, there will be an increasing in the leukocytes or in the white blood cells as the result of tissue tearing, and sometimes the leukocytes level will reach to 25,000 to 30,000, and this will happen occur around 2 to 3 days of delivery. With the musculoskeletal system, because of the stress of the childbirth, the muscle activity will be causing diaphoresis, fatigue, and also increase in body temperature, and also pain in the back and in joints, as well as even cramps in the legs of the mother. With the gastrointestinal, there will be motility and absorption of solid food, but then it will be reduced, and then the process of stomach emptying also will slow down because the progesterone level in the colon. There will be also nausea and vomiting because there are like a lot of undigested food as a reflex response to complete the cervical dilation. In the acanthagomen, there will be like distension in varying degrees, and also lacerations and even tears in the perinatal areas. In the endocrine system, because the onset of labor will trigger the contractions of uterine, and it will happening because of the decrease in estrogen and increase in progesterone, prostaglandin, and oxytocin level. Well, as we see the psychosocial response, we will learn that the mother will have euphoria facing childbirth, and sometimes the mother also will have amnesia during the baby birth process because it's like overwhelmed with the exhaustion after deliver the baby and after a placenta are born. So that is the material for today's topic. Thank you for your attendance.